Time now to bring in Arianna Huffington, co-founder and editor of HuffingtonPost.com. Arianna, good evening.
Good evening, Keith.
A big day. You won. Is that the way you see it, or where do you think we stand right now?
Well, I agree with Senator Schumer that this is not the time yet for a victory lap. We have many miles before we sleep. But what is very interesting is that despite the fact that the White House would have preferred a trigger, as Sam Stein and Ryan Grimm reported on the Huffington Post over the weekend, progressives made it very clear that any kind of bill without a public option would not have been acceptable, and that included progressives in the Senate, like Senator Russ Feingold, who said that on the Sunday shows. But also, Keith, let's just look at that bill carefully. There is still a lot in that bill which is very troubling. There is the concession to pharma, which means we cannot negotiate for lower prices because of the economies of scale that the government has. There is the fact that the public option would only really reach about 10 million people. It would not affect anybody who already has insurance through their employer. And there is, of course, the opt-out, which means that many millions of people potentially may not be able to have access to a public option. So there's a lot that is troubling, but it's definitely a step in the right direction with many roadblocks remaining.
Speaking of roadblocks, Blanche Lincoln, Ben Nelson, letting Republicans blocking Democrats on an up or down vote, as we just discussed with Senator Schumer. If they're not going to do that, is there a reason they are not saying so, and is it important to let them have their reason as long as they don't actually go with the Republicans on this?
Well, they can have any reasons they want, but it would be unconscionable for two Democratic senators to go along with a party of no that has caricatured and undermined any effort at any reform whatsoever. It's one thing to oppose one provision or another. It's another to go down against your own party, against something that the vast majority of the American people want. Can you just imagine the kind of commercials that would be run against Blanche Lincoln? Blanche Lincoln does not believe in democracy, does not want health care for her own constituents. I don't think she would want that, and I don't think Ben Nelson would want that.
And this all dovetails back into this late development here about discussions of kicking in some of this, at least the highlights, perhaps to seniors in time for next year. Obviously, there is the urgency of now to anybody who has health care that is less than 100%, which would be more than 100% in the country, who would probably agree with that statement, but there's also political consideration. Is it enough to get it to happen?
Well, you know, Keith, I find it unbelievable that we would accept waiting until 2013 before we have any kind of real health care reform. It doesn't make any sense. That's not what this country is about. It took 11 months before we had Medicare benefits after Lyndon Johnson passed signed the legislation. Come on, it took 8 years from the time that JFK said that we will put a man on the moon to the time we put a man in the moon. Is it going to take that many years to actually implement the healthcare reform that we are going to pass? It doesn't make any sense.
Well, Aetna did not own the moon. So there's your explanation right there, or the roots to it. Arianna Huffington of Huffington Post, as always, great thanks, Arianna.
Thank you.